Okay, our first panel of managed care organizations includes 2 MCOs, one who was successful in obtaining a contract and one who wasn't, to give their perspective on the procurement process. The chair calls Mark Sanders and Greg Thompson. Thank you for being here today. Mr. Sanders, we show you registered as Mark Sanders on behalf of Superior Health Plan, and you will be testifying neutrally, is that correct?
That's correct.
Great, thank you. Mr. Thompson, we show you registered as Greg Thompson on behalf of WellPoint, and you will be testifying neutrally, is that correct?
That is correct.
Okay. Mr. Sanders, please proceed.
Okay. My name's Mark Sanders, and I'm the CEO of Superior Health Plan. Superior has a 25-year history of offering Medicaid managed care services to members in Texas. With close to 1 million Medicaid members, we are the largest plan, the only plan operating in all 4 Medicaid programs, and we are statewide in all 254 counties. We greatly appreciate the opportunity to present to the committee today on elimination of inefficiencies in the provision of state services. My testimony today is centered on the inefficiencies that we have identified with the Medicaid managed care procurement process. I'm going to start with looking at the history and timeline of procurements. Each of you should have received a document from us that is titled Managed Care Procurement Timeline. In summary, since 2018, 6 procurements have been canceled, and a 7th one has received 8 protests and an initial unfavorable court ruling against it. This is in contrast to 2 procurements in that time that have been completed and implemented, and I will call out that one of those 2 had only 1 bidder participate. What this timeline demonstrates is an inefficient process that frequently results in cancellations. Each one of these procurements takes years and substantial resources to conduct, score, and make awards. In addition, most of these procurements involve protests and legal challenges with significant time and legal costs for all parties involved, including the agency, and only to result in a cancellation and restarting the process from scratch. To illustrate some of the issues with the procurements, I mentioned the procurement that has the 8 protests with it. I'll hit on some of the significant issues that we've noted with that procurement. The procurement did not take into account an evaluation of MCO provider networks. The strength of an MCO's network is critical in providing access to quality care in a Medicaid program, and we believe without that focus, you limit the ability of the state to select MCOs that can offer best value to the state and its Medicaid recipients. In addition, existing statute requires the agency to give preference to MCOs that have significant participation from traditional Medicaid and charity care providers in each service area. Next, the procurement did not take into consideration past performance of the MCOs and the quality of care delivered by the MCOs. For incumbent MCOs, that data readily exists to complete this evaluation. HHSC has made significant investments to annually grade the quality of care and health outcomes being provided by each MCO. This process is extensive and includes capturing millions of records through encounter and data submissions, all of which are subject to audit. The annual process concludes with an MCO quality report card scoring and MCO ranking for each service area. The report cards are provided by HHSC to Medicaid members as they enroll in the program, and HHSC provides guidance to the members selecting an MCO to look at these report cards and to check and see if the member's provider is in network. For potential new entrant plans, demonstrated performance could be provided from experience in other states or programs. Next, I'm going to refer to another one of the documents we submitted labeled MCO Market Share and Quality by SDA. In summary, this shows most service areas would lose their highest quality performing MCOs and the MCOs that have the highest member choice rates. In contrast, many of the SDAs resulted in incumbents with the lowest quality report card scores and lowest member choice rates being an awardee. This highlights the potential consequences of not considering past performance. In addition to historical quality performance, the procurement did not evaluate past performance in any areas. Instead, the procurement process relied on what is written and promise to be delivered in the future versus substantial historical performance. An MCO, for example, with an outstanding quality score and member choice rate of 62% within a market should receive consideration for such verifiable performance. The procurement process included a significant and unfair competitive advantage to one plan. While the scoring and evaluation process was still ongoing, one plan inadvertently received the written proposals from every other responding MCO. This occurred approximately 1 month prior to the advantaged MCO's oral presentation, which is a question and answer session and format that accounts for 10% of the scoring of the procurement. This was an example of a human error in the procurement process that the court found destroyed the integrity of the procurement. We believe that this and other errors should have already resulted in a cancellation and restarting of the RFP process. We know this was an error due to the fact that the agency sent an email to the advantaged MCO letting them know that the release of the other MCO proposals was in error and requested that this MCO destroy those documents. However, that email was not sent until months after the oral presentation period had closed. Lastly, the procurement resulted in awards that would be extremely costly and disruptive to the program. Through the elimination of most of the highest member choice MCOs, approximately 1.8 million members, or close to 60% of the total population, would be forced to lose their current health plan of choice. When I have previously listened to HHSC testify on this subject, a disruption analysis had not been completed as part of the procurement. Moving to my conclusion, when a member is choosing an MCO, HHSC recommends on its website that members ensure the MCO has their provider network and review the MCO's quality report cards. Obviously, this is good advice, but does not line up with how HHSC determines best value when selecting awardees. By not reviewing networks or quality performance, HHSC is disregarding its own advice. I believe it's also worth mentioning that there have been numerous efforts to reform the procurement process via legislation and restructuring of the process, including input from multiple consultants. Despite these efforts, there continue to be major struggles, as I've highlighted. I'm sure many of you are thinking, if the procurement process is inefficient, what is an alternative? We believe that alternative is what is referred to as an application state structure, or also known as managed care consumer choice. Under this structure, MCOs that meet stringent requirements as determined by the state, including strong quality and network performance, can participate in an open market structure where members can choose their health plans. This type of structure would better account for and connect member and provider preferences, quality, and cost efficiency. I should also point out that there have been 4 separate bills filed that would require the conversion of the Medicaid program to this type of managed care consumer choice structure. This concludes my prepared testimony. I'm happy to answer any questions from the committee.
Great. Thank you, Mr. Sanders.
Yeah.
We're going to have Mr. Thompson speak before we do the rest of the panel. And sorry for whatever hubbub is here. We might have technical difficulties, but it looks like they've been resolved, those from the outside doors. But it looks like we are being broadcast outside now. So anyway, with that, Mr. Thompson, and then we'll go back.
All right. Good afternoon. My name is Greg Thompson. I'm president and CEO for WellPoint, Texas. I'm also a native Texan. I was born in Odessa, went to high school in Borger, Texas, graduated from Texas Tech University and Texas Tech University Health Sciences Center. I am a blessed individual. I have a beautiful wife and an amazing 13-year-old daughter. After last night's algebra homework, I'm not sure that that is the truth, that it's amazing. We had a little trouble last night, but I'm thankful for y'all's invitation today to speak to you about the Medicaid managed care procurement process. WellPoint is a managed care organization. We were formerly known as AmeriGroup Texas. We have had the privilege of providing healthcare benefits for almost 3 decades in partnership with HHSC. Today, we serve multiple products. One of those products is Star Plus. That is an age, blind, and disabled population. We also serve the STAR and the CHIP populations. These are predominantly women's and children's services. And we also serve the STAR Kids program, which is a complex pediatric program in Texas. As I mentioned, we've had over almost 30 years of partnership with HHSC. We have deep respect for the agency, for their leadership, for how they conduct their business and what they do here in Texas. We are here today to talk about a procurement process, a process that the chairman mentioned earlier awards tens of billions of dollars in business to organizations like ourselves to care for millions of Texans. That particular procurement process was recently found to be, one, unlawful. And one of the main points for being unlawful is that the agency did not create cost efficiency benchmarks and use those in the procurement process. And two, a process that is anti-competitive because it awards mandatory contracts here in Texas. That procurement process has been uniform since 2021. The agency has used the exact same process because of a recent series of canceled, reissued procurements, what you've heard from the chair and also from Mark today. That particular process was created under an initiative called Project Stella. And Project Stella's intent was to create a repeatable procurement process that could apply to all managed care products in Texas. That would apply to Star Health, Star Plus, Star Chip, and Star Kids. And that particular process is the process that was found to be unlawful. So recently, a judge here in Travis County found that process to be unlawful on 13 different counts. And let me pause for a second to talk about the importance of that particular injunction. In Texas, an organization like ourselves, we cannot go to court and sue a state agency because we disagree with the results of a particular procurement or we're dissatisfied with those results. The threshold is extremely high. We have to prove that a organization, a state agency who has sovereign immunity broke the law. That is very difficult. The particular lawsuit and the process was a multi-month process, multiple depositions, discovery. It was a week-long hearing, and at the end, the judge ruled in favor of the plaintiffs that the process itself did not follow the law. Now, we didn't want to file a lawsuit against our primary customer. Who would? That was the last thing that we wanted to do. WellPoint has been an advocate for procurement reform for over a decade. Many of you are aware of this. We have tried everything in our ability to reform the procurement process to include metrics in procurement so that we would have successful procurements in Texas. We have also used the actual procurement process itself. We have filed specifications protests. These are protests that you file as a procurement is being issued, and if a respondent sees that that particular process is unlawful or has a fatal flaw or something is wrong with the specifications, we have to notify the state agency that they are there. We have filed those specifications protests, and from our information, the agency has not acted upon those specifications protests. We have also issued protests after the RFPs have been complete. Those particular protests have also been unsuccessful, predominantly because the respondents like ourselves do not have the critical information we need to file a meaningful protest within the time period. When we ask for documentations from the state to understand how the particular procurement was administered, they refuse to give us those documentation, while the actual protests themselves are denied because we did not provide documentation, the documentation that they withheld from us. Chairman, you're aware of our past advocacy for Rider 20. This was back in 2021. We advocated for the passage of Rider 20. Many of you may not know what Rider 20 is. It was a rider that required the agency to follow a law and implement a law that was passed in 2011. Yes, you heard me right. It was a rider that was passed in 2021 to ask the agency to follow the law, and a law that was passed in 2011. That particular law required the agency to create cost efficiency and quality benchmarks and use those benchmarks in procurements by giving a preference to high-performing health plans. This is one of the critical areas where the judge found that the agency was not conducting this. As a matter of fact, the agency actually said that they had not created these cost efficiency and quality benchmarks, nor had they used those in procurement. Now, last, I want to talk about STAR Plus. We, WellPoint, we also have an open litigation and a pending litigation with the agency on the STAR Plus procurement. That particular procurement used the Stella procurement process, again, a process that was found to be unlawful. The agency has also admitted that they have not created these benchmarks, nor implemented the benchmarks, nor used those in the procurement process. We have reason to believe that the STAR Plus procurement was also illegally performed. So at the moment, the agency understands that they have this pending litigation. We all know that there's laws that they were not following, yet they are okay with that. At this moment, they believe that it's okay that it was an illegal process because contracts has been signed and the business has been implemented. They've also said in a recent court hearing, I was sitting just not too far in the Travis County Court, and they said that at the moment that they intend to likely use the entire 12-year period in contracts in STAR Plus, meaning that they are okay with having illegally procured contracts active in Texas. This is why we're here today. This is why we're here in front of this committee. We're asking you to listen, to understand. We're asking for support of cancellation of the current procurements and also support of procurement reform. We believe that you cannot reform something if there are active procurements that are moving right now. So cancellation and move to procurement reform. Thank you for my time.
Thank you. Actually, Representative Tindall, if it's okay, I wanted to just start with asking some questions. From the perspective of trying to, I mean, I've done some work on this, as you know, over the years, but not every member on this committee has, and obviously almost no one that's watching this, if they can, through the Wi-Fi that's down. But if you could help us maybe just try and get, and both of you did a great job laying it out, but maybe to kind of Vice Chair Vajani's point is, it starts with the RFP process, which we can start with the RFP process, and then how that procurement worked out years ago, and how it didn't, right? There were some mistakes that were made, but wanted to even get into a little bit the application process itself, right? So it starts with the RFP, and if you want to take it from there, but just high level, like there's an RFP, it comes out, there's an application, what does that look like?
Sure.
How is that reviewed? And
Yeah, I'll
that's okay.
I'll take the
However you
application,
want.
or I'll
Okay.
take the procurement process. Do you want to take
Sure.
application? Okay.
Sure.
So the procurement process itself, as I've mentioned, that's the way the state issues contracts for managing the Medicaid populations in Texas. The RFP comes out. It comes out in a draft form. So that draft form comes out. Everyone who's in this business is aware that these drafts are coming out. We review the draft. We wait for the final RFP to come out. Once the final RFP comes out, that is when I was talking about the specifications protest, that is the time to tell the agency that there are some issues with the way the procurement is structured. During the procurement process, you end up submitting a very lengthy submission. There are questions that you have to respond to. Some of those questions are as simple as, can you explain your claims process? Can you explain your IT security? You also have information about the basic benefits. How do you manage the benefits in Medicaid? Specifically in our complex populations, it's about service coordination and how do you deliver person-centered care. We also have questions around member examples and scenarios, complex member. We also have information that we submit on core financials. Can we get a bond? Do we have insurance licensure? Those types of things. Then the state, we submit those, and the state then scores those RFPs. At the scoring process, there's a time in which individuals, respondents, are placed into what's called a competitive range. And that particular competitive range is not known to us, so we don't know what the competitive range is, but we are placed in a competitive range. And if you're in that competitive range, then you're invited to participate in orals. Orals is a process much like a job interview. You sit in front of our state customer and you answer some questions. There are uniform questions that all respondents answer to. After orals, then there's a step that's called certification. So those individuals who are then continue to be in the competitive range after orals, then you're asked to go through a critical certification step that is required by law, that all organizations are certified to manage the business. And then after that step, the state issues what's called a notice of intent to award. That notice of intent to award is not actual contracts, it's the intent to award contracts. And at that point, it triggers a 10-day window for anyone who wants to protest those notice of intent to awards, that they must file a protest within 10 days. The protest process is a two-layer. First, it's with the procurement office, and then the second appeal to your original protest is with the commissioner. After you have exhausted those administrative protests, the next step is a lawsuit in court. So that's the next avenue.
Great.
Yeah, I would just add a little bit to that, and this kind of overlaps into my testimony. Specifically, the procurement process does not take into account past performance. So I think, HHSC collects all kinds of metrics and reporting from us. They put those through auditing procedures, but they specifically don't utilize those results in how they're scoring and awarding the contracts. They also don't evaluate our network, which again I highlighted as one of the most critical things that a managed care organization brings to the table as a network. So, and then Chairman, did you want me to speak to an application state or?
Yeah, I'm just curious.
Okay.
I mean, for people to know what the process is, it's not, it just, there's an application that's out there. It's lengthy,
Yeah.
asks a lot of questions, and if you just talk about.
Sure. So an application state would look like, the state can set the requirements as high as they want for a health plan to be allowed to enter the market. And once you've met those requirements, you're allowed in. So it's really how the commercial and Medicare worlds operate today. It's an application. If you can meet the requirements, and then it can be structured. The contract can still, between those health plans and the state, can include all the things that are in there today that we have to meet requirements. There can be active management of those plans, and if they're not living up to those requirements, then they can be exited from a market. So that's at a very, very high level, but we'd be happy to go into more detail.
Sure. No, that's great. And I got just a few more questions, but this is DOGE, not public health or health and human services or appropriations. And so what we want to do, obviously, is look into maybe on the efficiencies of the provisions themselves. And that's a word that does a lot of heavy lifting around here, right? Like how do we, as part of this committee, go and look at how these contracts and these procurements are run? And Mr. Thompson, you mentioned that in some cases, and ours is about the provision of government services, and our oversight includes state agencies, that you had at various times been asking for documentation or that you were asked for documentation. So could you, or whoever the two, but we should talk about why, right?
Yeah.
I mean,
for one, we're asking for documentation about what are the things that the agency was evaluating when they considered the numerical value of the awards. Specifically, we were looking for how did they evaluate quality? Did they look at NCQA accreditations? We also wanted to know how they were evaluating cost efficiencies. Those are things that we knew that were required by law. They were not defined in the actual procurement itself by the instructions and the language that was in the actual document itself. And so we were curious how the state was meeting those particular contractual obligations or the legal obligations that they had to do those things. And if you allow me to dive down a little bit deeper of what do I mean by cost efficiency, I will lean into this a little bit, and I'll be very brief and try to get it down to bare bones. Today, there is no comparative metrics on cost efficiencies from one MCO to another. So let's have a scenario where it's one geography and there's 3 MCOs operating in that one geography. And they all have the same products, and the quality of each of those MCOs is the same. Let's just make believe that it's the same. One MCO contracts with a provider at 100% of Medicaid. MCO A, let's call it MCO A. MCO B contracts with the provider at 105%. And MCO C contracts with a provider at 110% of Medicaid. And they all have a tonsillectomy. Let's call it a tonsillectomy. So MCO A pays 100% for that tonsillectomy, MCO B pays 105%, and MCO C pays 110%. The tonsillectomies are performed, they're all great quality, the kids are healthy and well, but the cost to the taxpayer of Texas is different. MCO A actually saved 10% from MCO C. That particular comparison never occurs. Cost is only compared to the expected cost of a particular MCO. So I'm held accountable to what the actuaries expected my costs to be year over year. I'm never compared with my competitors in a particular geography. And these are the types of cost comparisons that we are advocating for to make sure that it's critically important to know that you can't just look at cost alone. You must look at quality of care and you must look at satisfaction. You can't just look at one piece, but it is critical to look at cost, and that's one area where we believe that there's some opportunities.
Okay, so on that point, so again, going back to what this committee is focused on in our jurisdiction, it's waste, fraud, and abuse, right? So I'd like to talk about those 3 words and definitions, and this is, again, just trying to get us all level set for what's hopefully not going to be a long day, but a good conversation about all of this. But when people talk about waste, fraud, and abuse, oftentimes they do talk about healthcare. They talk about the providers, they talk about the insurance, they talk about all of that. You know, I was once on the Healthcare Select Reform Committee, and that's mostly what we also talked about as well. But what you're talking about right now might be considered under the wasteful part of it, right? Which is, how do we make sure that we are, nothing's happening illegally, but it's just people are being wasteful, right? Within the bounds of what they have, maybe taxpayer dollars could be used more efficiently. So along those lines about different prices and different levels for different providers, what do you all do, or what should the agencies do to go and minimize and prevent that kind of waste from happening?
Sure, I can start that, yeah. So I know Superior, and I believe all the plans invest significantly in tools that are going to help us identify fraud, waste, and abuse. You know, we're all required to do that, number one, but it's our own incentive because we're paid a fixed premium and we want to avoid unnecessary costs. So we are very focused in this area. And what I would say is we really identify this through lots of different means. One area that's become very big for us is an analytical approach. So we do a lot of analysis of the claims that we received and look for patterns of upcoding or inappropriate billing. We also look for coding that shouldn't exist. And so we have ways in our claim system to stop that up front. We can do what's called putting a provider on prepayment review, where we think something looks off and we can request records to support the billing or not support the billing. And then the other thing we do, once we identify those type of situations, particularly if we believe it's fraud or could be fraud, we make a referral to the Texas OIG. We have a very strong partnership across the plans with the OIG. And so we both, the OIG and the health plans, have resources to do investigations, go actually visit the provider, again, ask for medical records to support the billing, or in some cases, obviously not. So I know it's very high level, but it's something I know that we're very focused on.
Thank you. All right, so then the second part is related to waste. And so when especially when it comes to Medicaid, people think about providers maybe who are double billing, underbilling. But as the taxpayers, what do you all do to minimize that kind of fraud from occurring?
Yeah, it's very similar. It's tools that we have in place that can identify, for example, we can pay a fee that for a hospital room that if it covers the whole hospital room, and there can't be what's called unbundling, which is then billing for specific services that are included in the global fee. So we have our claim systems really built to identify those situations and not pay or those expenses, or if it's something not as straightforward as that example, we can identify something that looks off. It's the same thing, fraud, waste. It's really the same processes that we use across, and then really the difference between fraud versus waste and abuse is intent. If we can identify intent that they intentionally did something, that's when it becomes fraud. So it's really managed the same way and the same preventive efforts.
Can I add
Please.
to that just a little
Absolutely.
bit to
Yep.
frame it up? So I think most managed care organizations have some internal organizations that do just exactly what Mark is mentioning. We call those program integrity or something there of nature. We also have SIU units that really handle those more critical cases that may actually move into those fraud cases where we're putting a provider on prepayment review, referring them over to the OIG so that they can see if there's other providers in the similar fashion or conducting the same activity. I know for us on an annualized basis, when we look at fraud, waste, and abuse, in total, it's well over $100 million in our organization alone that we identify and find and recover those dollars. So it is significant.
And so on the third piece, so again, waste is not illegal, maybe not unethical, just wasteful.
Yeah.
Fraud is illegal, intentional, and that kind of stuff. And abuse is the part I've had some difficulty understanding because it's something that's maybe not illegal, but probably not ethical. And so, Mr. Sanders, I've given this committee a copy of an email that you sent to your private investigator. And there was a time, committee members, one of the things that I like the most about this committee is all the questions we ask. And it's about trying to get to the root cause of what the problems are. And I remember there was a time when I asked a lot of questions too. And I didn't know that you could be penalized for asking questions, for trying to find out to the taxpayers and the constituents how their money was being spent. And so there was a time where there was a report, and what it was is the age-old story maybe of an insurance company that was denying claims. We've all heard about it. We understand sometimes when it's needed and sometimes when it's not. But I don't think what any of us expected was for a health insurance company that is funded mostly by Texas taxpayer dollars, that they would use some of those monies to hire private investigators, that they would hire a private investigator to follow a mom whose child was being denied medical care, causing that child further damage, and that this health insurance company would pay this private investigator to follow her around. That this private investigator, at the behest of you, Mr. Sanders, went and started to do the background checks to find out whether, with the former employment of a woman who was paralyzed from the neck down, Heather, that you wanted to know, and you found out who her friends were, to try and find out if she had some ulterior motive. Again, she was paralyzed from the neck down. But it didn't stop there. You also decided that you were going to go after the journalist who had written this article to expose or at least illustrate and document what had happened. So you went and you hired a private investigator to do that as well. So, Mr. Sanders, have you ever tasked a private investigator firm to dig into the background and financial or personal records of any state government official or their wife?
We've done what I would call general research, anything that's publicly available. Yes, we have done that, but nothing beyond what is publicly available.
So you've hired private investigators to look at not only, but also people who have filed claims and felt that they deserved those claims, but that you felt that they didn't, and you were doing that for what purpose? Why would you go and run a background check, hire a private investigator to follow, to dig into the records of people who are your customers?
Yeah. Well, first of all, I will say we no longer use that practice and haven't for several years. At the time, we really just wanted to have information on those individuals and really nothing beyond that of what was publicly available to us.
You did this also, though, to folks who might have a say in the procurement process or in the contract or in the legislative process in voting for that. Did you not?
Not in the procurement process that I can think of. Nobody in the procurement process.
But people who are involved in possibly approving budgets related to that. And so what you did is you dug into the research of individuals that had a say into potentially your company's ability to get paid for Medicaid contracts.
I would say we didn't do that research on those individuals, but not for the intent of a procurement.
Did you ever do this for any elected officials outside of Texas?
Not that, no.
I think we're going to find out if you did.
Okay.
Members, any other questions for the witnesses? Representative Tinderholt.
Thank you, Mr. Chairman. So, of the two of you, who won the process, the bid process?
We did.
You won the process.
We won 3 service areas as well.
Okay.
Yeah.
And so, who filed the lawsuit?
Both of us.
Yeah, us 2 and 2 other plans.
So, have you won the bid process in the past before this?
We previously had 9 service areas from the previous procurement.
We did as well. We had business before this, yes.
So, did you lose areas compared to the last time when you had these contracts?
We did.
Yes.
And so, did you file a lawsuit last time because the process wasn't fair or ethical?
So
I'm trying to understand.
we did and to be clear, the new procurement process began in 2021, and it began with a series of 4 procurements: Star Health, Star Plus, Star Chip, and Star Kids. And so that structure is the one that we are talking about that was considered to be unlawful. WellPoint did file a lawsuit in Star Plus. We were the only health plan to file a lawsuit in the Star Plus procurement. We were also the only health plan that filed specifications protest informing the agency that the structure of the procurement was flawed. And we were one of the 4 plans that filed the lawsuit in the Star Chip case.
Do you have lawsuits filed in other states that are anything even similar to this?
I couldn't speak on what lawsuits we have filed in other states. I operate just in Texas.
Same
But
here.
you don't know whether you have lawsuits, your company's filed lawsuits against other states?
I could get that information for you, but I certainly don't have that today.
So, as a committee, we're tasked with finding efficiencies, fraud, waste, and abuse. And part of those efficiencies means that we don't always want to pay less. Sometimes we want better quality, right?
Yes.
And so when we look at these things and when these proposals are looked at, I think it's important for us to look at a little bit of everything. So cost isn't the only thing we look at because the end users are our constituents and that's important to us. Would you be surprised that your ratings for 2024 for WellPoint were 3.2 and you guys were 3.5 ratings, which is considered below average across the country?
What's the source on that? I'm sorry.
Well, for you guys,
Yeah.
it was National Committee for Quality Assurance, NCQA Medicaid Health Insurance Plan ratings. The reason I'm bringing this up is when they're looking at these things, sometimes you get them because you have the cost is right, the quality is right, and everything is good. Sometimes you don't. And I'm trying to show the disparity because there are additional lawsuits, by the way. So when you say that you don't like to sue the state, I tend to disagree with the company. When the company doesn't win something, or they don't win it the way they want, it seems like there's lawsuits filed. But part of what we look at is quality. And so have you ever considered the fact that maybe some of those things you lost out to were a lack of quality? Is that something that you guys consider or think about?
We certainly agree with the assertion that cost and quality and satisfaction should all be considered in procurements. But those metrics should be clearly stated out in the RFP itself so that all health plans know what we're being held accountable to and what we're being held, judged to in the procurement itself. NCQA is a national organization that accredits organizations like ourselves. We have two legal entities in Texas. One is a 3.5-star plan, one is a 3-star plan. On average, I think pretty much everyone is a 3.5-star plan in Texas on NCQA. NCQA has several different components. One of the components is a standards accreditation, meaning do you have a process to manage claims and to conduct utilization reviews? You have to meet a standards. The next component is a group of quality metrics that's called HEDIS. Those HEDIS metrics are over 100 different quality metrics that are reviewed on an annualized basis, where the STARS rating kind of goes up and down annually. And then the third component is CAQH. It's an organization that does a satisfaction score for an organization. So NCQA is, in my opinion, is a great way to evaluate the overall quality of a health plan because it does consider your core standards. It considers a robust set of quality metrics along with a satisfaction component.
Yeah, I would just add, I agree. Superior is also a 3.5-star plan from the last NCQA accreditation process, which is tied for the highest. I would advocate for using NCQA in the procurement process.
So I got to be honest. I was handed this folder. I'm pretty disgusted with what I see in it. And I'm looking at you.
Yeah.
He was nice.
Mm-hmm.
I'm not so nice. The stuff that's in that folder, are you embarrassed by it at all?
Yeah, I am.
Why would we even want to do business with a company that operates like that? You're the president?
I
Is
am.
that correct?
Yeah.
I'm appalled. I couldn't believe it. I had to lean over and ask him, I'm like, is this real? I'm not joking. I've been doing this 10 years. This is year number 11 for me. And when I looked at the folder, I thought it was a joke. It's emails with your name on it. And you investigated people that are on this dais for doing their job for Texans. What do you have to say for that?
Again,
Because they were
Yeah.
trying to do what's right for the constituents. What do you say?
yeah, I think going back in time, I think it was just understanding what interest and information we could have be knowledgeable of when we're meeting with different individuals.
I disagree. You wanted leverage and you thought that you were going to use it. I dare you to investigate me. Do it and then bring it. I dare you to do that to me. That's disgusting. That you would do an investigation and you would pay for investigators to look something up in someone's background to try to leverage it. It's actually potentially it could be illegal. I don't know. I would ask the Attorney General to potentially investigate your actions on whether they were legal and whether you tried to use what you found out during those investigations against these people in order to gain billion-dollar contracts. It makes me wonder what the heck they're even doing with you in this position when you conduct yourself like that. I would never in a million years consider investigating a legislator for doing their job. I'm appalled and disgusted. I'm embarrassed that you would be sitting in front of us and that you would try to pretend like you were gathering information just to have it. You don't gather that kind of information to not use it. What were you really going to use that information for?
Just like what I've said. sir.
What?
What's that?
Say it again. I
Okay.
want to hear it.
Just to have general information about individuals we might be meeting with and knowing that they might have interest in certain things. That's really it.
So you want to know very specific information. Did you read the emails? Do you know what emails we're talking about? Because that's not what you were looking for. So what were you really looking for?
Really just what I've stated.
You're in the middle of a lawsuit and you don't want to answer me, I think. I think that's what it is. Look, we don't always get along up here on this dais. Sometimes we disagree with each other. Sometimes we totally get frustrated with each other, but these are my colleagues. These guys are my family. What you did is despicable. Despicable. If you're coming to my office to do it, I dare you to do a background investigation. I mean, it's just disgusting.
Members, are there any other questions? Representative Bowers.
Thank you, Mr. Chairman. And I usually don't agree with Mr. Tenderholt, but I have to say thank you for your comments. So I guess this part of my questions are for Mr. Thompson. So did you all win business in the most recent procurements?
Yes, we did.
And so then if you did win, then why did you sue the state if you won procurements?
Yeah, we believe that all procurements in Texas should be fair, competitive, and transparent. Mm-hmm. We believe that the current procurements did not provide that particular avenue. We knew that there were several aspects of the way the procurements were designed were illegal, and that's why we decided to go ahead and pursue with this case. And again, we have been advocating for procurement reform for well over a decade. And so we believe that this is something that we wanted to continue.
Okay, so it just seems a little odd to me if you won, but you find that it was illegal. So you came out on top, right? And then you're saying that the process was illegal.
That's correct. We had a current lawsuit in Star Plus. Mm-hmm. In the one of the first procurements, there was a series of 4. Starting with Star Health, then Star Plus, then Star Chip, and then Star Kids. We had an active lawsuit with Star Plus. The same structure of the procurement process was identical for every one of those products. And so we knew that when we filed the original lawsuit for Star Plus, that it was going to be applicable for all products. And so that is why we continued to pursue lawsuits in the last round of RPs, which were the Star Chip cases, or
Okay.
Star Chip RPs.
And thank you. And then Mr. Sanders, you won the Star Health procurement, correct?
We did.
And so if the procurement was illegal and wrong, why didn't you protest or litigate that procurement in the past?
Oh, yeah, we won the procurement, so there's no reason for us to protest, and we were the only bidder for the Star Health program.
Okay. Didn't HHSC use the same process with Star and Chip procurement?
As the Star Health, I believe it
Yes.
was similar. Yeah.
Mm-hmm. And so then for both of you, wouldn't the file incomplete application or application state give you more business because now you will be a statewide?
I'll take that. I don't think so. We would change to be statewide if we chose to operate across the state, but there would be more competition in each one of the geographies. And so today, in most of the service areas across the state, it depends on product and it depends on the service area, how many MCOs are operating in those service areas. A file and compete process would likely end up with more competition in a particular geography. Thus, your membership would be diluted.
Okay. So hasn't that been your ultimate goal these last few sessions, though?
A file and compete process has not been part of our mindset in the last few sessions. We've simply wanted to reform the procurement process to make sure that it followed all applicable laws.
And so how many of these processes have y'all gone through?
Personally, I think I've been involved in almost 10.
Almost 10.
I don't know the exact count, but it's quite a few.
It sounds like quite a bit, though. Almost 10, and I'm just having trouble with it because it seems like that's been your process, like to come to every legislative session asking for procurement through legislation and riders, throwing out our ideas that could possibly harm my community and my community plan. So is it your goal to win more business and market share through this process?
It is not. It is our intent to create a fair, competitive, and transparent process that is competitive. We believe that in a competitive system that the consumer wins.
So the consumer wins, or is it that you give your shareholders more money?
I stand by my answer is that we want a fair, competitive process. And when you bring competition into any industry, not just healthcare, any industry you bring competition, there typically becomes more services, richer benefits. We have something that's called value-added benefits that we're able to add into our Medicaid services. You will see in a competitive process that those benefits that end up benefiting the Medicaid's consumers will get better.
So then let's talk about the services then, because I think, we're talking about this procurement process, and it may help all of us up here. I don't want to speak for my colleagues, but to talk about the services that are provided through the Medicaid program.
Sure. I'll start. There's quite a few. The services are your basic acute health services, behavioral health services, pharmacy services, and in some populations, services like transportation, food, other non-medical drivers of health type services. When I'm talking about acute health services, that is everything from hospital visits to outpatient services to, again, on the pharmacy side, all the way into injectables. So it's very much like I hate to compare it to a commercial plan, but it's very much like probably any insurance that many of you have. It's a very good benefit package, and the state of Texas has been, in my opinion, has a very robust benefit package for Medicaid recipients.
And then do you have a percentage on the consumer that does benefit? You said that it would help the consumer, right?
The state of Texas sets the benefits for the Medicaid population. And that benefit package varies by product. So if you're in Star Health and Star Plus and Star or Star Kids, it's different. CHIP is an actual commercial product in Texas. So the benefits are different, but the state sets those. The one thing that managed care organizations can control is what's called value-added benefits. Those value-added benefits are those extras that we may offer to our members. That comes out of our profits. That is not something that is a cost to the taxpayer in Texas. Those are things like extra dental benefits or vision benefits, or maybe it's one thing that we do that's we have lots of maternity health benefits. So gift cards for a mom who completes her prenatal and postnatal checkups, they may get $50. We also have summer clubs and boys and girls clubs. Those are extremely popular, that we pay for those club benefits for individuals. So things like that.
And so I guess I just have to ask, my father was a doctor for almost 40 years here in the state of Texas. And so what type of care are these patients receiving?
You want to?
Yeah, sure. I feel like these members are getting the same care they would if they were a commercial member or Medicare member. We certainly want to provide the best network and providers to provide the top care that's available, and making sure that it's accessible. That's really a big part of our job. So we spend a lot of time making sure that our members have access to care, and if they run into any issues, it's our job to clear those hurdles and make sure they can get the care they need.
To add to that, I would just say that specifically in managed care Medicaid, there's certain populations that receive service coordination. That is something that the traditional fee-for-service program did not offer. Knowing the Medicaid population, many of our members have many challenges above and beyond just access to medical services. Often it's access to food, it's access to a home, a roof over their heads, it's access to transportation. All of those things are critically important for our members. And so we provide service coordination. So often, especially in the Star Plus population, you may have someone who's elderly and may not have anyone in the home to help them. We have a person who's on essentially a speed dial that can help them coordinate their benefits. So if they have a question about what doctor can they go see and do they need help coordinating a physician visit, we will get on the phone and have a three-way phone call and make sure that provider visit is scheduled. And so that service coordination is really critical. It's something that's, I would say, a cornerstone of many of the Medicaid programs in Texas.
And I guess, you mentioned certain populations, and those two words just stung me and stuck out for me. So I think you said elderly. Are these certain populations low-income families?
I think I use certain populations and related to the different products. So apologize for my words, but it was just describing the different products, whether it was a Star product, a CHIP product, a
Gotcha.
Star Plus product. Most Medicaid recipients are lower income. That is one of the qualifications for those benefits.
So I may have more questions in a little bit. I'll open it to other members. Thank you.
Representative Cook.
Can one of you just talk a little bit about the difference in continuity of coverage versus continuity of care? I mean, so like, I'm told that one of the benefits of this process is the continuity of coverage, and so I just want to understand the difference between the two of those and the prioritization between the two of you.
I can start with continuity of care is specifically relevant with the procurement process whenever there are changes in health plans from one plan to another. HHSC has provisions in the contracts of the plans to make sure that there's continuity of care. So I mentioned the networks are a significant part of the health plans. Going from one health plan to another, that member the new health plan may not have their physician and network, but the contract that HHSC has with the new plan requires them to honor that continuity of care so that they can continue to get care from that provider. I will say that provision is limited in its length of time, so it'll help with the transition, but that could be part of the disruption is that members may have to find new providers that are in network with the new plan. So that's one of our concerns. Continuity of coverage is really just do they qualify? Do they continue to qualify for Medicaid and stay on the roll? I know recently you may have heard some noise about the redetermination process. So during the PHE, all of the eligibility rolls were frozen. So that if a member technically would have lost eligibility, they stayed on because of the requirements of the PHE. So HHSC went through a massive redetermination process over a year ago where about 1 million members or over 1 million members came off the eligibility rolls. Those would be how I distinguish the two.
Okay, thank you for that. What was the time period of when you started working on this procurement process?
For the Star and Chip, I think it was issued in 2023, if memory serves.
2023.
Yeah. So we started then. So over 2 years ago.
Well, that's when it was decided, correct?
It was announced in March of 2024 where the awardees were announced.
And so you started working on it in the summer of '23.
Let me find the exact date. We started working on it when HHSC released the RFP, which I don't have that date off the top of my head.
Do you have that date?
I don't have the date, but it was in 2023 when it was released.
That's when the request went out.
Yes.
Yeah.
Right. 'Cause the reason I ask is looking at the what you call publicly available research that you were doing.
Yeah.
In my business, I've certainly have, as a lawyer, as a divorce lawyer, I've definitely have made requests for surveillance and things like that. I have myself or people in my office that can research publicly available information. So what's the real reason? What was I have a very small company, so I can imagine the resources that you have available within your office. So I don't think you need to hire a licensed private investigator in order to get publicly available information.
That really was the intent.
That's the best answer you have, is
Yeah.
that you were looking for public. Why didn't you just Google? We can sit up here and
We probably could have, yeah.
And why did you find it necessary to look into divorce records of legislators?
I don't recall at the time.
Well, I'll give you as much time as you need to
Okay.
think about it.
Okay. Yeah, I don't know. I would have to get back to you on.
Is the answer there's no good ethical reason that you'd be looking into a member's divorce file? Can you think of any reason?
Off the top of my head, I can't.
That's all I have, Chair.
Representative Rodriguez Ramos, and then.
Thank you, Mr. Chairman. Mr. Sanders, when did you start leading Superior?
I became the CEO of the plan in January of 2017.
January 2017.
Yeah.
17. And it appears this email that we received was in May, so just 5 months after you started with Superior, you're asking for this information. And then there was a auditor's report in January of 2018 that was not very, didn't really, there was a lot of questionable activity with SuperiorHealth, and the auditor's report in 2018, January 2018, and it specifically stated among several things, like the commission allowed Superior to report approximately $26.9 million in bonus and incentive payments paid to affiliates' employees that were unallowable under the contract with Superior. It also said, it cited among other things as well, Superior did not consistently respond to appeals and notify providers about appeals as required by the commission's Uniform Managed Care Manual. And then there were other things, and one of the things that stuck out and right before the recommendation said, allowing Superior to report bonus and incentive payments, which are unallowable costs under the commission's cost principles, result in Superior understating its net profit in its financial statistical report. That affects the calculations that determines whether Superior owes money to the commission under the experience rebate profit sharing requirements. So the timeline is very interesting. You start in January. In May, you're asking about background information from my colleagues, one including my desk mate. And then this not-so-positive report comes out 6 months after you're asking for the background information. Was it in any way to affect or to impact or to kind of color the results of this auditor's report that was going to not highlight some things that are not so positive about Superior?
No, it was not. Completely unrelated. I do recall the bonus issue. So As part of our state contract, Superior and all the plans are required to file with HHSC our bonus plan to make sure the bonus plan meets the requirements of the contract and all the state requirements. So we had done that timely and received our approvals for those. The distinction here, I think, that the state auditor's office made, and we issued our response to nuance this out in response to the state auditor. But all the employees of Superior are under a management company and not Superior. And then therefore, they said, that's really why they said that they shouldn't be allowed, when really we are all employees of Superior. And the only reason why we have employees under a management company is when you have a company with multiple entities, it's easier to administer payroll, benefit plans, 401k plans for one entity versus many. Similarly to how state employees are paid by the comptroller's office, one organization that administers the payroll and benefits for all its employees. So that's really the distinction. I think it was really more form over substance was the difference. The state auditor just took a different position on that.
So I imagine all of these recommendations that they suggested were being followed by you all.
They should be, yeah.
And last question, what did you do with the reports from these individuals that you were asking? What did you do with them? Because you
Really?
received them, but what did you do with them?
I didn't do anything with them really, other than just become aware of the information that was in them.
And is this standard practice for what you were, I mean, you just started with them 5 months prior, so is this something that was?
I'd been with, I should point out, I
As
was
the
the
CEO.
CFO of the plan for 3 years prior to becoming the CEO.
So you were the CFO for the time period that they did the auditor's report?
Let's see, that was January. Yeah, I probably would have been then. Yeah, I can't remember what years they audited specifically.
Interesting, thank you.
Okay, Representative Vice Chair Bojani.
Thank you, Chairman. I had a quick question. So I think you all talked a lot about past performance, and that was not utilized by HHS. When did you find out that HHS is not using past performance? Was it before, during, or after the procurement process?
It was after when we got information that we requested as part of our, I guess, Public Information Act request.
So how do you imagine moving forward that someone can ask about past performance if they've not operated in Texas?
Yeah, I think that a health plan, a lot of the metrics we mentioned in CQA, there's a lot of similar standards in each of these areas that health plans can submit from their other programs or states that they're in that would be applicable.
Also other states, but not in Texas.
Or it could be in Texas. A health plan could be in another program and in bidding for the Star and Chip procurement.
Okay.
I agree with Mark that there are certainly organizations like NCQA that are national standards. That if you're operating a Medicaid health plan in Texas or Florida, New York, or California, you can become NCQA accredited. Now, the benefits and some of the nuances of the Medicaid programs are certainly going to be different state by state.
Yeah.
But the standards that NCQA requires are the same, no matter what.
Yeah.
There's also the HEDIS measures that I mentioned earlier, the quality metrics that are included in that are a standard set of quality metrics no matter where you are in the United States. And then the satisfaction survey, the CAQH survey, again, it's a uniform and standard survey. So it would be, in my opinion, quite easy for an organization or the state agency to ask for references, essentially, for a like program in a different market, a different state, and what was your qualifications there. And so I do think there would be, could be a straightforward process to allow for those individuals coming in from out of state. Mm-hmm. There are examples of that in other states where these types of questions come up all the time.
Okay. Do you know how often does this happen where you don't win procurement and then you file a lawsuit? Is that something that happens all the time or very rarely?
This is the first time we've filed lawsuits in Texas against the state. This is not something that we do regularly. We have been advocating for changes in the procurement process, but it was a significant decision for us to sue the state. That was not a position that we wanted to be in, and it's a position that we had no other option.
And you went through the whole protest process, and then
That is correct.
okay.
We first and foremost, we advocated for change before the procurement started. So well before the series of procurements, we advocated for certain things to be implemented so that the agency could have a successful procurement process. So we started this before anything even occurred. And then, as I mentioned, along the way, WellPoint filed specifications protest, again, before health plans started working on procurements to indicate that there were flaws in the procurement so that people would not waste time, effort, and money. And so we exhausted every single step of the way, and we got to a point where we had no other choice but to move into the courts in Texas.
I just feel I don't know if it sets the right precedent to be able to, there will be winners and losers in every contract.
Correct.
So then losers will always be able to file lawsuit, especially if they currently are in contract, because they can extend the life of the contract and continue to enjoy the benefits. And, it's just, I think the legislature definitely is not a good referee for any of those, but, I think we'll see how it plays out.
I would just go back to the lawsuit that was filed was an ultra vires lawsuit, which means that we had to prove that the agency did not follow state law. That's a significant threshold. And so it was not a complaint that we simply didn't get the business that we wanted. It was that the process itself did not follow Texas law.
All right. Thank you.
Okay, I have Representative Kane and then Representative Campos. So Representative Kane.
I'm trying to be quick. Ms. Thompson, if you could maybe summarize it for us, though, and I'm trying to understand this matter. Regarding procurement, is there a time where, I don't know, maybe you're incentivized to delay awards? Is there any time where it's financially beneficial to you to delay an award?
I would say that if an award is delayed, typically your current contract is extended. That is what has actually recently happened, is that the agency extended current contracts for the STAR and the CHIP programs in Texas through the end of August of 2026.
So, I mean, like through delay, does that mean you get to keep your market share?
We don't get to keep our market share, but we keep the existing geographies that we're operating in today. But I would say there's no reason to push for a delay in a procurement, just simply to delay. You would be advocating for the fact that in this particular case, that the procurement process itself was deemed unlawful, and that particular lawsuit needs to work its way through the court system, and then we'll find out the results at the end.
Okay. Is it similar with cancellations for the procurement?
Yes, the structure today, we're all operating in extended contracts, I think, for most of the Medicaid products in Texas right now.
Okay.
So if the procurements were canceled, the expectation would be that the current contracts are extended. Again, we are advocating for procurement reform so that we would be on a fast track for the next round of
Thank you, Mr.
procurements.
Thompson. Mr. Sanders,
Yes,
same
sir.
question.
Yeah.
Is there a financial benefit for canceling, delaying procurements?
I think in this case for us, there probably would be, but that's not our intent. Our intent is to have a fair procurement, and that's why we took the actions we did.
I mean, have you ever pushed for cancellation or pushed for delays?
We filed a protest on I think it was the STAR CHIP RSA RFP a few years ago. We won the protest. It was canceled because they found errors in the calculations, and so I know we did then. It's similar.
Was that financially beneficial to your organization?
It was. I mean, we were going to lose some of the service areas that we were in and
Yeah.
lose membership. Yeah.
Okay. How are you doing today? How are you feeling, Mr. Sanders? How's it going for you?
Yeah, it's been a rough hearing.
I can see that.
Yeah.
See that. Have you ever met with any of the members of this committee prior to today? Have you ever met any of these folks?
I've met with Chairman Capriglione before.
Okay. Were you aware of kind of the issues that have been brought up, the looking into legislators and looking into their private lives? Were you aware of that before today?
I was, yes, sir.
You were. My concern is a lot of my colleagues up here have had questions, and it seemed like you didn't have answers to it, or maybe weren't prepared, and I would have thought you would be if you were aware of it. Is there somebody that is prepared we could talk to?
Not that I can think of.
Okay. Have you retained legal counsel for yourself?
In regards to what?
This issue?
No.
Okay. Thanks, sir.
Okay.
Representative Campos.
Well, I am besides myself that you would go to that extreme. And I've been an advocate for Superior because y'all take care of so many people in my district. And so we serve to do right for our communities. And to think that you would disrespect us like that is completely unacceptable. So how do you expect for us to have faith in Superior?
Yeah, to your point, I think we're a health plan that does right by its members. We care about our members. We deliver.
That's what I've always thought, because there's so many seniors that y'all take care of, and my family members of mine, and that's why I've been an advocate for y'all.
I
So
appreciate
for you to be affiliated with them, it's just, and so where are those documents that you requested? Do you have those?
I don't.
Did you destroy them?
I did.
You have no copies anywhere?
No, not that I'm aware of.
So what was the point in you making those? What did you do with them? Read them and throw them away?
I read them at the time, and I no longer have them. Yeah.
Does your investigator have copies of them?
I don't know.
Can you find out?
I can.
Will you let us know? And if you can get copies, we'd like to have them.
Yeah, sure.
Thank you.
Members, any other questions? Representative Troxclair, then.
Thank you. First, I want to ask about your lawsuits in other states. It seems that this is a pattern, as has been pointed out by others. What's going on in Georgia right now? You lost a procurement, and you're suing that state as well, saying that the process. I mean, this is an article. I just Googled it. An article from earlier this month, suing the state, saying the process was, quote, mismanaged, rife with errors, and reckless practices. I guess this is your parent company, so it sounds very familiar to what we're hearing today.
Yeah, I'm not involved or knowledgeable of that process or our health plan there, what they're going through, but I'm aware that they had challenged the results, yes.
And they being your parent company?
The health plan, I guess sister company, I would call it, Peach State Health Plan.
And Centene?
Centene's the parent, that's correct.
Right. So, and at least 20 other states have settled with Centene over its pharmacy benefit manager operation that I guess mismanaged Medicaid patients?
That sounds correct, over 20, yeah. Yep. I will say Centene has fully exited the pharmacy benefit management business completely several years ago.
I mean, do I just speak for everyone in this room or everybody in Texas? What the heck is going on? We are all just trying to do our best to, take care of our kids and pay the insurance and run the errands and do all the things that we have to do. And we're paying into insurance, and we expect to receive good medical care. And it's a constant runaround. It's a constant hamster wheel. Texans continue to be sick. We don't know that everybody points the finger in a circular firing squad. And then now we're up here talking to a company who has received millions, billions of dollars in taxpayer funds through Medicaid contracts, who have used that money to then hire private investigators to follow around patients and legislators that are asking questions about what the heck is going on. It just shouldn't be this hard. It's ridiculous.
Okay.
And I know, well, I would say you're being put on the spot here, except for you're not. You knew this was coming. Or you knew this was happening. Well, you were the one that was asking for those private investigations.
Yeah,
How are we supposed to sit up here and believe what you are telling us, to make any change, to put any stock in what you are saying? It's exhausting. You don't think it's exhausting as a legislator to run for this office thinking that you're going to make your constituents' lives better and be met with this crap? This is insane that the state government committee has to sit through this, that this is the kind of issues that we're dealing with because we don't have companies who take responsibility for the taxpayer money that they are awarded and do right by the Texans who have paid for it. When are you going to tell us that you're going to do better? You're going to change. And instead you come here and complain that you didn't get a procurement? What kind of grand miscalculation was that?
yeah, I don't have a response, sorry.
Okay.
Yeah.
Well, I have a couple follow-up questions then. So going back to the private investigation, we've talked about the legislators. Has your MCO ever tasked a private investigator or firm to look into the background, financial or personal records of any state employee?
I'm trying to think, not that I'm aware of, but I can't say for sure.
Do you
I
think
believe
that-
those, like I said, I think those were from several years ago. We have not used that practice since then. So
How are we supposed, why would we believe that?
I don't know.
Okay.
I'm just saying that.
Have you ever contacted the Office of the Inspector General during an investigation to assert that the investigators should not be asking questions of your employees?
Not that I can think of. We cooperate fully with any audit from the OIG or any regulatory audit.
Have you ever obtained whistleblower information from an HHSC employee and then used that information to initiate litigation against the whistleblower?
No.
Okay, I look forward to our further discussions.
Okay.
Members, Representative Bowers. Representative Bowers? Okay.
Thank you, Mr. Chairman. Just wanted to make sure you were recognizing me. So I guess I'm still stuck on the number of states, as my colleague, that y'all have lawsuits with, especially for you, Mr. Thompson. Are you aware that WellPoint is suing Mississippi, Kentucky, and Nebraska in addition to Texas?
I operate in Texas. I know that there are various matters in other states, but I could not speak on the validity of what those matters are and what states they're in.
Are you aware, though?
I'm aware that there's matters in states, but I could not list to you those states that there are issues in.
Did you list your position with WellPoint? Is it listed on here, your position with the company?
I'm president and CEO for WellPoint, Texas.
And that's where I'm going with this, because I would think if you're the president and CEO that you would know what lawsuits are out there within your company.
We operate in many states across the U.S., and there are a lot of activities. And one of the things that, as an organization the size of us, we don't necessarily talk about lawsuits that are happening state by state. One is we don't need to know, and two, we've got enough on our hands in our own geographies. I'm not saying that you're incorrect. I simply just don't know the right answer for you.
And I appreciate that. I guess, I don't know. I mean, I do try to communicate with legislators in other states to know what they're doing, what makes sense, and how we make it palatable to Texas. So I just would think that you all, and especially you're within the same company, right? It's within the same company that is suing in those other states, right?
It's underneath Elevance, yes, I think is what you're referring to.
So you're aware, but you're not sure to what extent.
That's correct.
Got it. Thank you.
Members, are there any other questions? There being none, thank you for your testimony.
Thank you.
Appreciate it.